Asthma attack and heart attack are very similar. Sometimes it's very confusing whether it's heart attack or asthma attack. There's a possibility of misdiagnosis. And especially when you're talking about cardiac asthma, the attack seems to be asthma attack, but actually it's not. The attack is by heart. So it's very difficult to identify whether it's heart attack or asthma attack. And when you don't understand, there will be a difficult thing because it's difficult to treat. Treatment is different. When you have asthma attack, treatment is one way, and when you have cardiac arrest or heart attack, the treatment is different. In these cases, the symptoms are wheezing and shortness of breath. So when it is heart attack, how can you guarantee that it's not asthma attack? When you think it's asthma attack, how can you guarantee that it's heart attack? So even when the heart fails, there will be the wheezing and shortness of breath. It seems to be asthma attack, especially when you have been suffering from asthma. It's very likely that you think that this is asthma attack. But when you have asthma for a long period of time, it develops heart disease. So asthma disease is a lifelong process. It is a chronic disease. But if you do not keep it under control, then what happens? It can lead to heart problem. A heart attack comes from atherosclerosis problem. The plaque is formed because of excessive calcium in the blood and excessive LDL, low density lipoprotein in your blood. It's true. But the symptoms are very similar. Symptoms are body's language, and a language is sometimes ambiguous. And a language can also be metaphorical. So it's very difficult to identify separate heart attack from asthma attack. Other thing is that the chest, there is a central cavity inside the chest, and there sits both heart and lungs. How can you separate? It's very difficult. One is affected, the other is affected as well. One effect leads to the other. When you are talking about asthma, it's because of inflammation in the airways. And if you are talking about heart, then there is arterial blockage. So both lungs and hearts are very close by. Asthma is a chronic condition, and there is a fight between immune system and environment. So everybody has got immune system inside, and because of the environment, suppose dust, pollen, cockroaches, dirty places, that may lead to you asthma problem. So asthma is chronic, it's for a long period of time, and this is because of the fight between immune system and environment. So environmental factors are very important, and this is in contact with immune system. And heart attack is a long-term process, especially because of atherosclerosis. If you have plaque, if you have block, if you have atherosclerosis inside the artery, vein that lead to a heart, what happens? The heart attack comes from long-term processes of atherosclerosis. So there is a confusion between asthma and heart. Asthma is chronic and heart's problem is acute. Immediately, someone may die. When you have asthma attack, it can also lead to death, but that's not as acute as heart attack. So heart attack is absolutely acute. Within a very short period of time, one can die. In asthma attack, there may be a possibility that the patient will die, but still it gives you time, and it's not that much quick. That's not abrupt. So chronic inflammation, if you have, then you have asthma. So asthma is because of chronic inflammation, problem with the environment. There's an immune system that creates asthma. And this chronic inflammation, that is asthma, can lead to a risk of cardiovascular disease. So asthma is not usually serious. Sometimes you have asthma attack, it's true. But if you take care of your environment, if you take care of your health system, if you take care of your food, especially if, vegetables and fruits, then you can keep asthma under control. But cardiovascular disease is very difficult. It's very important that chronic inflammation, that is asthma will give you risk of cardiovascular disease. Asthma attack is related to respiratory system. You cannot breathe properly, and this respiratory system is the rebellion of the lungs. Lungs are fighting for respiration. When the lungs fail, there will be asthma attack. And this is also inflammation and constriction of the airways. Because of inflammation, the airways can get thicker, and constriction, because airways are not that much broad, they can go narrow because of inflammation. And where do they come from? Allergens. When you have dust, when you have cockroaches, when you have dirty weather environment, then it happens because of allergens, because of bad environment, the asthma attack takes place. On the other hand, heart attack, that is also called myocardial infarction. So myocardial infarction, that is the cardiovascular disease, and cardiovascular system means blood supply to the heart muscle. If you do not have proper blood supply to the heart muscle, it will go wrong. So cardiovascular disease is heart attack, and it is also called myocardial infarction. And heart attack, what happens? It abruptly cuts off blood. Clot is responsible. So when you have heart attack, it will abruptly cut off the blood supply because of the blood clot, because of atherosclerosis, and ultimately it kill tissue, right? It will lead to tissue death. And asthma, on the other hand, is the battle for breath, and heart is the struggle for blood flow.